Hello, my name is Samu. I'm a nurse and software developer, and today I will be showing you how to use NurseBrain Synapse to do your bedside shift reports. So, for this example, I went on YouTube and I searched for bedside shift report, and I got this video,
Into a close and it's
which I thought was really good. It's from this hospital system here, and it's really great because they use SBAR. So I will go ahead and play the video, and at the same time, I will show you how I do my handoff reports using NurseBrain Synapse. So here we go.
time for bedside report. This is your new nurse, Patty. She's a great nurse. I'm leaving you in very experienced hands. And this is Audrey, Margot's daughter.
Hi, nice to meet you both. I'm replacing Sandy and I'll be with you till 7 a.m.
We're going to start report now, so feel free to add any information or ask any questions. Margot Carley is a 56-year-old that came through the emergency department and admitted for pneumonia.
Okay, Margot, can you please state your full name and date of birth?
Sure, Margot Carley, 6/26 of 60.
Thank you.
Margot presented to the emergency department early this morning with difficulty breathing, cough, and chest pain. She had a room air oxygen saturation of 84%. She has a history of a recently treated pneumonia, and we are currently giving her IV antibiotics and IV steroids through a PICC line on her right side that was placed this morning after multiple IV attempts. She also has lactated ringers running at 125 an hour.
Okay, Margot, I'm just going to check your PIC line here. Yes, and this. And we have lactated ringers running at 125.
She was given a Norco for pain about 2 hours ago. How is your pain right now?
I would say it's about a 3. I'm feeling much more comfortable though.
She's also been started on breathing treatments. She recently had a neb. Did you find that effective?
Much, much better. I was feeling really short of breath earlier, but the treatment really helped.
She does seem to be breathing better now, but I'm wondering when the doctor will be in so we can talk to her about her CT results.
Your hospitalist, Dr. Massey, will be in later this afternoon to discuss the results of that CT scan.
Okay, I'll be sure to stick around so I can ask him some questions.
Margot did have an x-ray and CT of her chest and is looking forward to discussing the results.
Okay, Dr. Massey's great. He does a good job at answering questions and will address your concerns while he's here. Once I'm done getting shift report, I'll check on the status of when he's able to get here.
Thank you.
I appreciate that.
Margot has a oxygen saturation of 93% on 3 liters today. We're titrating to 92.
Okay.
Her oxygen demands did increase while she was up. She's walked the hall twice and did well. She's tolerating her cardiac diet, although her appetite is poor. She had a BM this morning and is voiding fine.
Okay, how are her labs?
She does have a white count of 12, which indicates an infection. Other than that, her labs were fine. And she has a VTE score of 6. That's the risk for blood clot. She's got the compression sleeves and medication ordered for prevention.
Okay. I'm just going to be checking your SCDs here.
Okay.
Margot.
She's at a moderate fall risk with the yellow socks and wristband in place, and she's been using her call light appropriately and gets up well with 1 assist.
And the band, and we have the palette. Great.
That ends my shift report. Any questions, Patty?
No, thanks for a great handoff.
All right, any questions?
Okay, so that was the shift report. So now NurseBrain Synapse is organizing all the details, and it'll provide an SBAR summary for this patient and also some recommendations on how to provide the best care and also a custom-made nursing care plan. So here we go. We have the SBAR summary right here. Let's expand. We have the situation, Margot Carley, 56-year-old female. We have her background. She had a CT scan, as I was mentioning. And what else? She has a PICC line as well. I recall that they mentioned for her diet that she had a cardiac diet, which is accurate. So that's great. And then also, this is a progress note called a SMART note. It is auto-generated with the SBAR information for this patient. And then also it has a custom-made nursing care plan that is tailor-made to this patient, Margot Carley. And it has a nursing diagnosis. It has 3 of them, and also it has interventions. So the first nursing diagnosis is for the impaired gas exchange for pneumonia, and then another one for effective airway clearance, also related to pneumonia, and another one also for imbalanced nutrition, because if you remember in the video, she has a poor appetite. So we have some recommendations for that. And let's go ahead and go back. So we can actually flip this card or simply just rotate it. And so here we have some suggestions which are AI generated. These are actions to take for this patient, some recommendations, and also these are the things to look out for. So, for example, if she has signs of respiratory distress or using accessory muscles, you should notify the provider. Also, just monitor changes in oxygen saturation levels, etc. Even here, it talks about sepsis too as well. So those are things that you would want to notify the physician or the provider of. And here we have a to-do list. So this was not auto-generated using AI. This is actually a pre-made checklist. It's called a routine. Basically, drawing labs, completing charting, medication pass, head to toe. And the way that this is created is on the to-do list. You just go to edit routine, and then you just ahead of time you just pre-populate your checklist so that every time you have a patient, it'll automatically be populated for that patient. So we'll just go back. And so if we want to make changes to our patient, let's say something was missed, AI is not 100% perfect. So let's say you wanted to add some more information or something happened later on in the shift, just slide to the right and tap update, and then you can go ahead and change the information. So for example, we noticed that she doesn't have a room number. So this is a required field, but it wasn't included in the video. So we'll just say she is in room 123A. And then also her code status, it wasn't provided in the video from what I recall. So we'll just say she's full code. But everything else is provided. We have her chief complaint here. We have the fact that she has pneumonia. That's her diagnosis. Her attending physician is Dr. Massey, which was mentioned in the video. Let's just say she has no allergies, drug allergies. And then she's on fall precautions. Recall in the video, they mentioned that she has yellow socks and a yellow wristband, which seems to be pretty universal. All the hospitals I've worked in, patients who are at fall risk usually have like yellow wristbands or yellow socks. So just some more information here. They did mention that she has a CT scan that was performed and an X-ray too as well. I believe that's pending. And then some of her medications, etc. And this is the assessment. So all of these fields were filled in for you by the AI. And then of course you can always modify and change anything as necessary. PRN. Remember, she has a PICC line. So on her right side, it's getting LR at 125 ml, so that's good. Our AI was able to pick that up. And then also she has her white count or WBCs were 12, showing signs of an infection, so that's good. We could have also put 12 here too as well, but this is fine. That'll work. And I don't recall, a lot of her vital signs were not provided, just the O2 was 93, but of course we can always add more vitals here if we wanted to. Let's just say 130 over 130 over I don't know, let's just say 80. Okay, so let's see. Okay, so here the normal range is 120, so if it's 130 it'll be above it, and that's fine. Okay, and then once you're done, you just hit save, and those changes will be made. Now we have the room number as well, and also some of the information that we changed, like the blood pressure here. The systolic is 130, diastolic is 80, so that's showing. And also the progress note or the smart note will be updated, and it'll also reflect the newest changes. And every time you make changes to the patient, the smart note is generated automatically. And also in addition, the nursing care plan, if it needs to be adjusted, it'll be adjusted automatically too as well. And so that's pretty much how to use NurseBrain. It's very simple, very easy to use. You don't have to even type anything. All of this that you're seeing here was essentially just created automatically without you having to manually type anything. There are other ways to add patients. You can add patients using a QR code where you can import a patient. The other nurse would have to use NurseBrain, and they would have to click on the QR code, and then you would just scan it, and then everything that they entered or was generated would be transferred to your NurseBrain Synapse. Also, you can add patients just by typing in any order, doesn't matter, and our platform will go ahead and organize the information for you in using the SBAR format. If you prefer to have a more guided approach, more detailed fields, then you can go ahead and enter information into each field. We have the SBAR format, so situation, background assessment, recommendation, and that's it. So this has been a sample. This has been a tutorial on how to use NurseBrain to do bedside shift report. This is our dashboard. We have 1 patient and 10 tasks, as you can see. And big shout out to this YouTube video from UP Health. Thank you for showing us how to do a bedside shift report. And this is how we do shift reports with NurseBrain. And hopefully these nurses at UP Health will eventually start using NurseBrain Synapse because it's a lot easier and really accurate. And it avoids using paper clips and clipboards and papers and pen, really helping them to really pay attention and focus on the actual handoff report. So thank you for watching, and come back soon for more videos.